My name is Lora Mullinax. Today is November the 6th, 2014, and this is my persuasive speech. Let's suppose that you are doing fine. You're at the top of your life, everything is going your way, and suddenly you have a severe brainstem stroke. A stroke from which you will never recover, nor will you ever wake up. The hospital has placed you in the critical care center, and you are on full life support. You are technically dead, except for the machines that are keeping you alive. Your brain stem has enough function left to allow the machine to keep you alive indefinitely. But the rest of your brain, all your thoughts, your memories, senses, ability to wake up and take care of yourself is completely destroyed. You are not here to speak for yourself, but whether you want to remain on life support in a nursing home for the rest of your life, probably at great expense to your family. The doctor is explaining your condition and lack of options to your 3 grown children. He is recommending terminating life support and allowing you to die peacefully. Your son and your youngest daughter tend to agree with the doctor, but the oldest daughter will not hear of this. She feels she would betray you by letting you die. She begins to argue with her siblings in the hall. Day after day they come during visitation and have a confrontation about what is to become of you. The arguments are becoming louder and security has become a regular presence on the floor. This is a familiar scene on many hospital floors when patients face death and haven't chosen one person to make the decision about their care, or have an advance directive to let the doctor make the choice on your behalf. Advance directives are not something that we think about until we are seeking medical assistance in a hospital. A nurse will ask on admission, "Do you have an advance directive?" If I did not work in the medical field, my response would be, "What is an advance directive? And unless I am dying, I probably don't need one." However, when you are faced with questions concerning your health, you are generally able to make a decision with the help of a doctor's recommendations. We make our own decisions every day, but what if you are unable to make your own decision due to being unconscious? What if you were in an accident and were left in a state where you would only be kept alive with the help of machines? Would you want to live without knowing your surroundings? In this speech, I will be defining an advance directive, talk about who benefits from having advance directives, and how you would prepare an advance directive. So what is an advance directive? An advance directive and living will go hand in hand. A living will is a legal document that states any medical treatments you would and would not want to be used to keep you alive, as well as other decisions such as pain management or organ donation. You should address a number of possible end-of-life care decisions in your living will. Your doctor can explain the following procedures that may be offered to your family on your behalf. Some of these procedures that could sustain your life would be resuscitation, which would mean CPR, the use of drugs to stimulate the heart, or no attempt could be made at all. Mechanical ventilation or intubation will take over your breathing if you were unable to do so. This would consider if, when, and for how long you would want to be placed on a mechanical ventilator. Tube feeding would supply the body with nutrients and fluids intravenously or via a tube in the stomach, and this would decide if, when, and for how long you would want to be fed in this manner, especially if there is no hope for your recovery. Dialysis would remove the waste from your blood and manage fluid levels if your kidneys could no longer function. Antibiotics or antiviral medications can be used to treat infections. This could include medications such as blood pressure medications. Comfort care is another option. This would include interventions to keep you comfortable and manage pain, while abiding by your other treatment wishes. This may include being allowed to die at home, getting pain medications, being fed as long as you are able to take food and fluid, and avoid invasive tests or treatments. Organ and tissue donations for transplantation can be mentioned in your living will. If your organs are suitable for donation, you will be kept on life-sustaining treatment or life support temporarily until the procedure is complete. You should state in your living will that you understand the need for this temporary intervention. Donating your body for scientific study can also be listed. You can contact a medical school, university, or donation program for information on how to register for a planned donation for research. A healthcare power of attorney can also be named in the living will or advance directive. While the document can stand alone and can be carried out by your doctor, sometimes choosing one person, whether family or not, to intervene on your behalf can decrease the stress of other family members. If you have made a choice to allow nature to take its course, then your loved ones may not feel guilty about taking drastic measures to continue your life. Who will benefit from you having an advance directive? You, the individual. You will have the final say-so regarding your care in the event that you were unable to decide or speak up for yourself due to a medical issue. You do not have to languish in a long-term nursing care for 40 years at great expense to your family. Healthcare providers benefit because they will have a clear document stating exactly what you would want done in the event that you were unable to speak for yourself. Your family members would benefit in knowing that you personally made the decision about your care in the event that you are not going to survive. Now let's talk about how you would prepare your advance directives. Advance directives need to be in writing. Each state has different forms and requirements for creating legal documents. Depending on your location, a form may need to be signed by a witness or notarized. You may use an attorney, but this is often not necessary. Links to free forms are readily available on the computer. Organizations such as the National Hospice and Palliative Care Organization and the American Bar Association have forms available that can be completed easily. Be sure to review your advance directives with your doctor and healthcare power of attorney to be sure you've made your choices wisely and that they are aware of your wishes. In determining your wishes, think about your values, such as the importance to you of being independent and self-sufficient, and what you feel would make your life not worth living. Would you want treatment to extend life in any situation? Would you want treatment only if cure is possible? Resources for organizing your thoughts and having conversations with others about medical care and end of life are available through the American Bar Association and Conversation Project and the Center of Practical Bioethics. When you have completed your documents, you need to do the following. Keep the originals in a safe, but easily accessible. Give a copy to your doctor. Give a copy to your healthcare power of attorney. Keep a record of who has your advance directives, and talk to family members and other important people in your life about advance directives. You can change your advance directives at any time. If you want to make changes, you must create a new form. New copies and destroy old copies. You should consider reviewing your directives and creating new ones in the following situations. If you're diagnosed or if you have a disease that is terminal that will significantly change your life, discuss with your doctor the kind of treatment and care decisions that might be made during the expected course of the disease. When you marry, divorce, become separated, or are widowed, you may need to select a new health care agent or power of attorney. Conclusion. This is my conclusion. Living wills and other advance directives are written. Legal instructions regarding your preferences for medical care if you are unable to make your decisions for yourself. Advance directives guide choices for doctors and caregivers if you are terminally ill, seriously injured, or in a coma, in the late stages of dementia, or near the end of life. By planning ahead, you can get medical care that you want, avoid unnecessary suffering, and relieve caregivers of decision-making burdens during moments of crisis or grief, and avoid confusion or disagreements about the choices you would want people to make on your behalf. Advance directives aren't just for older adults. Unexpected end-of-life situations can happen at any age, so it's important for all adults to prepare these documents.